Hello and welcome. You're watching FYI. I'm Sonal Mehrotra Kapoor. Now, with the caseload in the country, if not decreasing, not increasing either, lockdown in several states, meaning the numbers are somewhere plateauing just a little bit. A lot of attention now is shifting to post-COVID care. We have told you earlier about heart complications post-COVID. You all know by now what black fungus is. But one post-COVID complication found only in kids is often ignored. It is known as MISC. More and more doctors now in the country, also in the UK, are raising alertness to the syndrome found only in children. It caught our attention because a mother went through a horrifying experience here in the country. She wrote to FYI saying more parents need to know about this, and I promised her a program, and here we are. So let's understand now what exactly is MISC. First up, let's understand what exactly is MISC. What does it stand for? It stands for multisystem inflammatory syndrome in children. Most children who become infected with COVID-19 virus have only mild illness, but in children who go on to develop MISC, some organs, tissues such as heart, lung, blood vessels, kidneys, digestive system, brain, skin, even eyes become severely inflamed. In most, it is being seen in kids between the age group of 3 to 12 years of age. It goes on to 18 as well in certain cases. Now, if you're a parent watching this, do not get into panic. Remember that MISC still is quite rare, and most children who even develop this eventually will get better only on medical care. It is only a small percentage of kids who rapidly get worse to the point where their lives are at risk. Now, much remains to be learned about this emerging inflammatory syndrome. So if your child has any of these symptoms that I'm going to tell you about, get help fast. If your child has rash on the skin, is vomiting, has diarrhea, is feeling unusually drowsy, or has an inability to stay awake, has redness in the eye, enlarged lymph nodes as well, faster heartbeat, rapid breathing, redness or swelling seen in lips, in tongue, in hands or in feet. A lot of time kids can't describe what they are going through, but they just keep saying that they're not feeling very well or they go extremely quiet. That's a sign you have to look out for. Now, what causes MISC is still unknown, but why some doctors are calling it an invisible killer is because kids with MISC test negative for RT-PCR. And what's more often has been seen is that they even have good amount of antibodies. Now, this is a syndrome which can, thus meaning, only be detected through symptoms. So parents or any caregiver needs to be extremely watchful. But there is treatment. What is that treatment? Let's sort of familiarize you to that a little bit. MISC has to be reported urgently and treated aggressively. The medical procedures that your doctor might involve might have to do with tests to look into inflammation in the body. That might lead to blood tests, chest x-rays as well, a heart ultrasound, an abdominal ultrasound as well. Doctors may provide supportive care for in extreme cases for symptoms and may also use various medicines to treat inflammation. Most children who become ill with MISC will need to be treated in the hospital. In extreme cases, because doctors simply cannot take any risk, some children will need to be treated in intensive care units as well. But remember, every child, every patient is different. So take the advice of your doctor, of your pediatrician before jumping to any conclusion or getting into a panic. All right, having understood that, let's take that forward with our experts. I'm very delighted to have a full panel of pediatricians for you, many of whom have been looking into MISC for the past year or so. We have one expert joining us from UK as well to see if there are any learnings that we can take from United Kingdom as well. Let me introduce to you Dr. P.S. Narang. He is an Associate Director, Pediatrician at Max Healthcare. Thanks so much for your time, Dr. Narang. We have Dr. Jeshal Chet joining us from Fortis. We have Dr. Mahesh Katre joining us from NSH England. and we have Dr. Sameer Dalwai with us. He's also a practitioner and he's joining us from Mumbai. He's part of the pediatric task force there as well. Dr. Narang, first to you. You've been treating several such patients in the past year or so. Apart from what I've just highlighted, some of the key takeaways you think that parents need to be watchful for?
Sonal, you have really summarized it very well. Okay. But for parents, I will say one thing, that along with the symptom you have described, the rashes, the swelling on the hands and feet, not necessarily every child will have all the same. Any problem, if the child is looking unusually unwell, okay, his hands and feet are getting cold and he is finding it difficult and he's looking very pale. Now this is the time that we have to think that this syndrome is involving the multisystem. And when I say multisystem, we are worried about two. First is the heart, because if the heart stops or pumping less, all these features of low blood pressure, feeling weak, peripherally cold will happen. And because of the multi-inflammation of various tissues, they have a problem and they will have a high-grade fever or all these fevers. I mean, if you have even two of the symptoms and your child is looking unwell, whatever symptoms you have described, then we must take precaution and immediately report.
Right.
Very rightly, you have said that a lot of times antigen is negative and it can happen. The child may have a very mild illness of COVID and pass off and remain normal for weeks and then start the problem.
Right. Dr. Jaishwal, let me bring you in on the conversation now. I actually got thinking about MISC because actually a viewer of FYI wrote to us and she said that she had one patient of COVID in the house, but all the other family members tested negative, including her boy, a teenage boy. Now, she kept saying that, he was such a lively kid, but suddenly I noticed he went very quiet. And because she was wife of a doctor, she was alert enough to sort of get thinking on it and, getting into it. Later, they discovered that he had got COVID, recovered, he also had antibodies. So we understand very little is known about why this actually comes into kids. But could you shed more light into how it actually emerges? And could it happen to kids who have not got COVID, or is it typically just a post-COVID phenomena?
So this is a very good point, Ms. Sonal. In last 1 year, I mean, in previous season as well as in this season, when we have seen these patients or the children coming to us with this kind of the Misc, we have seen that they are unaware of their COVID infection in the earlier time, because once the child has a COVID antibodies, that means child's body has actually made COVID infection, but probably
they've been asymptomatic.
Yeah, he was asymptomatic, and along with that, the family members were also asymptomatic, because the whole reason to screen the whole family will be if they suspect that, there is a COVID in the family. And screening rate was quite low, in a previous year. So we have seen many children coming to us last year, particularly where they were not tested or they were tested negative and they were asymptomatic and they came and presented to us with the Misc. Now, even if you do the testing, I mean, we all know testing also has a limitation, because the day of the testing, method of the testing, specificity, that is also, a thing which, we cannot say that it is 100% accurate.
There can be some misses there.
Yes. So, the other way to diagnose is to have the antibodies. So once you have the antibodies, and in the absence of Misc is a diagnosis of the exclusion, because, this is like any other febrile illness, but child seems to be very toxic with a very high grade fever, rigors, and, not responding to routine, medicines like paracetamol, high dose paracetamol. That is where we start thinking and send for the antibodies. And we also do and screen for other infections, because it's a tropical time, tropical country, May. So we do look for other infections also, but practically what we are seeing right now is it is mostly Misc, because children have not been exposed to many other diseases like what we have seen in last
because they've been homebound mostly.
Yeah. There is no dengue, there is no malaria. We do screen them, but there is like no lepto, because it is not the season. So we do screen and rule out other infections, and we don't find anything. And the blood work is classical of Misc. The presentation is classical of Misc, and the behavior is classical of Misc. Where but we every time we rule out other infection. because it is the diagnosis of exclusion.
Right.
But in the current time, our suspicion is very high. That is where we are able to identify more and more children, able to provide timely treatment to get them better faster.
All right. So it can happen in other cases, but mostly of late, because of COVID, you've been seeing mostly patients who come to you and kids who come to you have sort of had it post their COVID recovery as well. Let me bring in Dr. Sameer at this point. Dr. Sameer, typically how many days post your COVID recovery, that's at least if you're aware of it, does the first symptom begin to appear?
Yes, let me first congratulate you on a very good presentation so far, and both my other speakers as well. Typically, this comes in about 3 weeks to 3 months after the child has gone through the initial COVID infection.
Okay.
But as my colleagues said, you may
That's
not
a
be
big
aware
window,
of
3 weeks to 3 months. That's a lot of time.
That's right. Yes, and the point is you may not have recognized the initial infection. So the child, you may have had just a days of fever, you may have not noted that he had COVID. So actually it may just present with the symptoms that you and Dr. Narang and Dr. Desal said without a past known history of or recognized history of COVID. Now the 2 points I'd like to make. One is that the features that you described about MISC, parents need to be on the lookout for it, but they are not expected, and as you said very carefully in the beginning, we don't want to scare them or create a panic because this is 1 in a million. So the best thing is, if you find anything suspicious on these lines with your child, please contact your pediatrician or regular family doctor. We are from the Indian Academy of Pediatrics, we are anyway taking training programs to bring all the pediatricians in the country up to date with that. So one is contact your doctor, don't panic.
Right.
The second thing is we are going to have a monsoon season coming on soon. And many other monsoon illnesses also have the same kind of symptoms as flu. So I have only one message. Do not diagnose yourself, either positively or negatively. Take the help of your local pediatrician or your regular doctor. Do not panic. And if at all there is a MISC, we have very simple treatment which can be done for it, which needs hospitalization, yes, does not even need intensive care, and we'll talk about it a little later.
All right. So, can't emphasize enough on this. Just because we're doing a program about it and talking about all these symptoms does not mean that every child is going to get it. There are going to be few cases to ensure that your child does not fall into that. Information is key, and that's what we are trying to give out to our viewers over here. Let me bring in Dr. Mahesh now over here. Dr. Mahesh, you've been looking into the same trend in UK as well. Could you describe to us what are the percentage perhaps of kids being diagnosed of MISC looking like in the UK vis-a-vis here in India?
So, I mean, I think last time on the early show as well, I mentioned that we have been seeing consistently, especially from last year, actually after the first wave. And at the beginning, we actually couldn't recognize what it is. We have another condition called Kawasaki disease, which kind of presents in a similar way. And then we went on to that line. So you mentioned about percentage point of view, around 2 to 3% in England. It's quite possible that now maybe we know about this condition more. We are able to diagnose it more.
Right.
All my panelists and colleagues, and you have mentioned rightly at the beginning in terms of what signs and symptoms we see. As you said, we do need to rule out other infection conditions as well. So what basically we are doing is we are treating everybody who is coming with as a sepsis initially. We are making sure that there is no any identifiable source of infection, and then only we are going to the line of treatment. Now, in terms of the treatment, we are not giving a specific treatment. We are doing called a recovery trial. It's a big study all over UK, and then we randomize them to different treatments. Now,
what does this trial involve?
So trial basically involves the immunoglobulins, steroids, and then we randomize according to every patient comes in, and we have noticed that immunoglobulins and steroids, they are quite the recovery is quite good. But having said that, I must emphasize, please do not self-medicate. We have already seen side effects of steroids and all these things. And everyone has mentioned, Dr. Samir mentioned, Dr. Sejal, and everybody has mentioned that please go see your family doctor and pediatrician.
Yeah.
The good
Your
thing is-
pediatrician knows your kid the best, medically at least. Not to offend the mothers over there. Medically at least, your pediatrician knows your child the best. So please take their advice and do not get panicked when you look about these cases. This is going to happen. Just keep yourself informed and keep a bit calm.
Exactly.
Dr. Narang, I just, sorry, you go ahead.
So the good thing is, like, we haven't seen mortality. That's the main message I want to give. There could be, like, children might be unwell for a few days or weeks, but we haven't seen any mortality. So that's the good thing we have seen.
Okay, that's nice. That's a bit of a relief to hear, actually. Let me get that question to Dr. Narang as well. Dr. Narang, I also wanted to understand, are you seeing MISC sort of come out more during the second wave? And are the new variants, do they have a role to play in this at all?
Yeah, Sonal, I will answer that into two parts. First, as all my other experts have said about the post-COVID MIC. In that, the child has a COVID which is asymptomatic or mildly symptomatic, and then few weeks later, up to 3 months, develop an illness with a shock. Okay, but we treated about 70 such cases at Max Super Specialty Hospital following the first wave. In the second wave, we are yet to see the post-COVID because the second wave is going on. But in the second wave, we have seen 4 such children with acute Misc. What is difference between acute Misc is it has happened right with RT-PCR positive. Okay. Usually, in such cases, RT-PCR is negative. Antibodies are positive in about 50% of cases, not all. But if somebody in the family is having COVID or have had COVID, we have to be very suspicious. As Mahesh pointed out, every such child is to be treated in a septic shock. Whether the sepsis is a bacterial or the sepsis or the shock has happened following the COVID. So in total, in the last year or so, beside the Kawasaki similar illness, we have seen the Misc in about 74 cases, 70 post-COVID and 4 with COVID, with RT-PCR positive. For the second wave to present the post-COVID illness, we'll still have to see in few weeks. I hope it doesn't happen in that bad way, because if it happens in a bad way, the cases may be higher. But as you very rightly said, parents need to observe if the child is looking unduly ill and his hands and feet are going cold, is developing a rash, or the eyes are looking very red, swelling in the feet, they need to take expert help as quickly as possible.
Right. Actually, that makes this episode nicely timed, because this is the time people are recovering now, most of them at home at the moment. So this is a good time to watch out for these symptoms. And what's worrying for me is that 3 weeks to 3 months, that's a long time to really be under observation. But we really hope 3 months is generally the time asked for post-COVID recovery as well. So we hope that's in line with that anyways. Dr. Jaisal, your thoughts really on this, on what you saw perhaps in the last wave compared to what's happening right now?
So we have a little different experience compared to Delhi. We are seeing more Misc now, and we are seeing various presentations also. So last year we were seeing mainly children with the Misc coming to us with the poor cardiac function, where heart is not pumping normally, pumping less, or in the shock, which we call as a low blood pressure. But this year we are seeing the Misc in a various different forms, where fever is very high. Some of them have some problems with the blood cell lines, which we call as a HLH. We have also seen that, after COVID, 3 to 4 weeks after the COVID, has triggered the complications like, appendicitis, perforations, bleeding surgeries. We have also seen few children coming to us post-COVID with the diabetes, first time to be diagnosed. So as of now, we are still, having like, we cannot generalize everything that, this is the particular pattern we are seeing, but we are alert alert, we are cautious, and we are looking, more cautiously for any child who is little more sicker than the normal. And at the same time, when we are managing those patients in the home quarantine, the children who are stable, and managing on teleconsultation in the home quarantine, we always advise the parents that be watchful. Don't be panic, but be watchful. No need to do repeated examinations after the COVID, but at the same time, if you see any unusual sign or symptom or
you must inform your pediatrician.
Yeah, you must come back to the pediatrician. That's what we are emphasizing to each and every parent.
Right. Dr. Sameer, are there some things or a sort of preparatory kit or some immediate medicines that have to be given that parents can prepare for at home? Everybody has a COVID kit now, preparing for the situation. Is there something that parents can be watchful for? And also, I was reading up that there is MISC, which is for children. There is MISA as well, which is for adults. So if you could shed some light on that.
Yes, you mentioned that about pediatricians and mothers knowing the child the best, and there must be something in the fact that Mother's Day and Nurses Day are close together. What I'm going to say is that we are in this for the long haul, because it can be a child who has had a subclinical infection, you've not been aware about it, and any 3 weeks, 3 months later, he might come up with it. So as long as the pandemic continues, the parents have to be worried, look out for it. So my point of view is for the parents. First, there is no need to panic. Second, this is not something that's going to happen without you seeing it. You can see it in front of you. You can see the child having a high-grade fever. You can see the child having inflammation. The lips could be swollen. There could be a rash. The eyes would be red. So you will have enough time. What is important is that I would say, rather than panicking, take time off from work on those 1 or 2 days that you feel the child has a problem. Because rather than panicking and only depending on the pediatrician, who in most cases will be doing this online, it's very important. This is my practical tip. Take time off for yourself and that child that day. I know it's a big thing, taking our time off from work, but that one day will help you save many more days. Just yesterday, while we were preparing the task force, we were having a meeting. The most important thing we wanted to give the parents was a sheet of paper on which we want you to write down and record the temperature. Actually write it down. Everybody has a thermometer, and in COVID days, everybody has a pulse ox also. Yeah. So simple things like measuring the temperature, but writing it down. Even if you have taken the pulse ox,
it's easier to share with the doctors also, frankly.
Yes, that's the point. Because always it is the variation that's more important than absolute numbers. Right. If I have a child whose normal regular temperature is 96 or around there, and then I suddenly see a 2 or 3 degree increase, it may not be 105. Right. But even if it's, so I have a comparison. Of course. So the most important thing I would request parents is, the day you feel that your child has a little problem, take time off, make a chart, tabulate it, get in touch with your pediatrician and monitor it and share this with the pediatrician.
Right, because the pediatrician would also want to know the swing in the temperatures, right? Not just the absolute number at this point. Right. Very important tips there. I just have the last 30 seconds. I just want to bring in Dr. Mahesh over there for any closing comments as he has.
No, I mean, because we already passed the second wave here in England. Dr. Sejal mentioned a nice point as well in terms of diabetes and all these things we are seeing in post-COVID. As I said, I don't want to, make panic in our parents. Give paracetamol, give ibuprofen. There was a bit of concern initially in terms of giving ibuprofen, but the current research is that you can safely give it. So make sure that your temperature is under control, plenty of fluids. So do these initial measures, and as everyone mentioned, just watch for 24 to 48 hours, and then consult your pediatrician.
Right. Bottom line, if it happens to you, it is treatable. The mortality rate over here is very, very low. The signs will be enough for you to take note of and let your pediatrician know and let them take the final call on what is to be done. This has been extremely educational. Thank you all for your very valuable time, and we hope this will provide some handy tips for our viewers as well. That's it on FYI today. We'll see you again in the next episode. Bye-bye for now.